and are advised that this video contains women's business. Congratulations, you're having a baby. Let's work together to make sure you can be a strong mother with a strong baby, or burai, that's born on country. Australia is one of the safest countries in the world to give birth or to be born, but unfortunately, this is not the case for most Aboriginal and Torres Strait Islander peoples. In current times, the health of your mothers and babies is still negatively affected by the trauma of colonisation, socio-economic disadvantage and remoteness. It would be wonderful if birthing on country becomes a reality for all women in future. We acknowledge that your birthing place is around ceremony. It's about cultural interconnectedness, where you can revitalise and renew traditional practices for mother and baby. But just because you may be in an urban setting doesn't mean you can't have those things. Birthing is humanistic, it's a connection to country, and it is the start of your first ceremony. However, your desire to give birth on country may be tempered by many considerations, such as age, first pregnancy, shopping for infant needs, and a lack of emergency backup. These are very important things to consider, as there is growing evidence that prevalent chronic diseases like diabetes, hypertension, cardiovascular and renal disease begin in utero and in early life. So, any complications during pregnancy may contribute to a lot of not so good things, like a rise in small for gestational age, low birth weight babies, and perinatal mortality, preterm birth and smoking in pregnancy. About 30% of all Australian babies are born in rural areas, and the risks are greater for women from remote and very remote communities. However, we understand that you may feel that giving birth in hospitals miles away from home may worsen your health, as it breaks the link between strong culture, strong health and the land, a link that is usually strengthened during birth. We see how being away from community and other children while waiting to give birth can increase feelings of anxiety, stress and depression, as you wonder whether other children and family may be vulnerable while you're away. This is why we are helping you to maintain your desire to birth on country. Birthing on country requires your full understanding of how to best maintain a safe pregnancy, in combination with support from culturally safe healthcare workers. Here is how you can best prevent complications to maximise your chances of birthing on country. An early follow-up, as soon as you find out that you're pregnant, can avoid unnecessary medical interventions later in pregnancy, such as travel, induced delivery, or unwanted caesarean or surgery. On presentation, the first step to providing culturally safe maternity care is to make sure you're asked the following 3 questions. Are you of Aboriginal or Torres Strait Islander origin? Is your baby's father of Aboriginal or Torres Strait Islander origin? Will you identify your baby as Aboriginal or of Torres Strait Islander origin? From here, you will work with healthcare workers, traditional birthing leaders, or Aboriginal liaison officers to create a birthing plan by thinking about these questions. What can you work on now that will help you down the track? And what are your strengths? How can you use these strengths to build a strong relationship with your burai? Things that may need your focus include drug and alcohol use and creating a safe home environment. Alcohol and drugs are often only a part of who we are and what we do. Sometimes they can make us feel down and we can forget that we have strengths. But what you take goes to your burai too. So it might sound like a good idea to quit as soon as you find out that you're pregnant. However, with some drugs that can be very dangerous. With the help of healthcare workers, we can help you manage that, remembering that we all have strengths and these are what helped us to survive life's challenges. Once we recognise our strengths, we can work on building them to help you as strong women and parents. Another thing to ask yourself is, are you feeling stressed and overwhelmed? Knowing where your closest maternity service is important, as they should be a port of call if you sense you are not well, mentally or physically. These places will follow up with you from early stage pregnancy until around 6 weeks after your burai is born. We see that it should not have to be a choice between a safe birth or the culturally rejuvenating experience of birthing on country. Together, we can do both.